If you've been diagnosed with gout, you are likely weighing a decision as to whether to treat your gout with medication or with lifestyle choices or with both. So let's explore some of those options. If you're treating gout with medication and not a gout attack, but gout as a disease, then you're likely being offered urate lowering therapy. They're trying to lower your uric acid levels to below 6.5, and what it is 6.5 milligrams per deciliter, but that's not really important to know. The number they're shooting for is likely below 6.5. And so urate lowering medications will lower your uric acid levels by either restricting the uric acid that's being created or trying to excrete more uric acid. If you're talking to your doctor about medications, you're likely talking about 3 different types of medications. The first is allopurinol, and allopurinol tries to reduce your uric acid levels by blocking the production of uric acid. There's another drug that's very similar to allopurinol called febuxostat. Febuxostat has had some more serious side effects, especially cardiovascular system side effects. So allopurinol tends to be prescribed more unless you're having an allergic reaction or some other issues with allopurinol. The third type of medication is called probenecid, and probenecid works a little bit differently in that it tries to excrete more uric acid versus blocking the production of uric acid. The most prescribed, generally speaking, in the United States would be allopurinol, and it would likely be the first course of action unless there's something in your medical history which would prevent you from using allopurinol as the first course. Like with all drugs, these drugs do have side effects. Some are common side effects that generally go away as you become accustomed to the medication, and others can be more serious side effects which would require you to discontinue the medication altogether. And while these drugs are effective at lowering your uric acid levels, if they don't effectively lower your uric acid level to below 6.5 milligrams a deciliter, you are likely to continue getting gout attacks regardless of whether you're taking the medications or not. And these medications tend to only reduce your uric acid levels by a certain percentage. And typically, as you go higher in dosage on the medication, the more the percentage of reduction of uric acid exists as well, but you also have a higher risk of side effects with the higher dosage of the medication. And for some people, urate lowering therapy is a complete no-brainer. They have to get their uric acid levels down. They're unable to do so with other means, and they may have other health conditions which are now being aggravated by these high uric acid levels. And so for those people, they absolutely should consider urate lowering therapy. But for those who are not in that situation, you may also consider lifestyle changes as a way of managing your uric acid. So let's explore what that looks like. When you're looking at lifestyle changes, you're looking to impact 2 primary factors. One, how much uric acid is generated in your body, and how well do you excrete the uric acid from your body so that you don't get more gout attacks. Being overweight or obese can increase the production of uric acid and decrease your ability or the kidney's ability to clear uric acid from your system, both of which could lead to gout attacks. So if you're overweight, try to lose weight and come down to a healthy weight. Drink a lot of water. Water helps with circulation, digestion. It dilutes your blood. It dilutes the uric acid in your blood, and you're less likely to deposit those uric acid crystals in your joints, which cause a gout attack. So hydrate all day long. Avoid beer, most alcohol, and sugary drinks, as these have a twofold effect to increase the production of uric acid and also suppress the excretion of uric acid. So the less alcohol, the less sugary drinks you are, the less likely you are to get future gout attacks. Purines are the substance that get converted to uric acid. The more purine-rich foods that you eat, the more uric acid will be produced in your system. And if you're unable to clear that uric acid fast enough, that could lead to a gout attack. Check the internet. There are lots of lists for purine-rich foods. They're going to be red meats, organ meats, seafood, all kinds of foods like that. Exercise regularly. Exercise helps keep your body weight down. It also improves circulation and your overall health. And when your overall health improves, your kidneys are more able to excrete the uric acid. Everything's functioning just a little bit better, and you are less likely to get a gout attack when you're fit. And then there are a lot of natural remedies that you can use to reduce the inflammatory response in your body, to try to dilute and reduce the amount of uric acid in your blood. Oftentimes, these natural remedies take a little bit longer to work, so you have to be consistent with the natural remedies. And there are many to try out, and we're going to list a lot of them in upcoming videos, so follow and like if you want to learn more.